Okay, I'm Dr. Philip Yu at the 21st Century Regenerative Medicine Institute, and today we are going to demonstrate Helen's her umbilical cord Wharton's jelly-derived stem cell grafting with knee decompression to open up the medial knee joint, because that's where it's almost bone-on-bone. And it's going to be with ultrasound and laser guidance to make sure it's double accurate. Okay, so first we're going to scan the joint to make sure we're going to insert the needle correctly into the joint space. And Nurse Carla is going to operate the ultrasound. So we're looking at the medial knee joint right here. And if you could close in on, I'll show you exactly where that joint space is, right here. And I'll show you our secret sauce. We add some decompression, which is going to open up the joint space. That way the needle will pretty much go in like butter, and the cells will actually be pulled in there because it's going to cause negative pressure. There's the joint space right here. You feel that pull, Helen?
Mm-hmm.
Let me know if it's too much. It's a very gentle pull. It's very subtle. So in fact, here's what it's doing. It's right here, that joint space.
Okay.
See, that opens it up right
Yes.
there.
Yes.
Yeah.
This is
You
where
feel
she's
that
gonna
pull,
go
right?
Medially?
Yep.
Injecting medially? Okay.
That's good.
Okay.
And we could go ahead and wipe the gel off. Just I'm going to disinfect it right there. And I'm going to mark the target with the laser scanner.
That was stem cells you put in.
Not yet.
No.
Yeah.
No, this is, we're just looking at the knee joint space.
So this
Make
is
sure
a,
we're going in the right area.
this is an infrared thermometer, and what I'm doing, I'm scanning her knee to see where the greatest point of inflammation is. Her upper knee is about, lower knee is about 75.8. See, look how much more inflammation she has up there. 134. So we're going inferior. Superior, we go medial laterally.
Where do you do left one? There's way more information, I'm sure.
Yeah. That's where you have most of the pain. So there's a heat
And this one right on the disinfectant.
On the, yeah.
there. See, right on the area of greatest inflammation,
gel.
look at compared to down here. So
Oh, yeah.
we want to go right there. Okay?
I've already had the stem cells in my arm.
I know.
You're already 5 years younger, just 5 minutes ago.
I'm very observant.
We won't hold that
As
against
you
you.
can see, if we go inferior, we compare that, we get a spike in temperature right on the medial joint.
Spray will be cold.
So that helps numb the area, so as there's a local anesthetic response, so we don't have to use lidocaine.
Deep breath.
So here's we're going to mark the area with the laser guidance.
Breath still okay? It's okay.
There's not a lot of space
Ah,
there.
felt that.
There's not a lot of space there, as far as I can go. So, yeah. That's probably gone there.
Doesn't exactly feel like butter.
Yes. You feel the gentle stretching in there? Good.
Is that the deadness? Numb it?
Yes. It's cryo spray, so that helps numb the skin, so you're not going to feel the needle go in. We don't like to use lidocaine because, you know, it's a local anesthetic drug. Plus, some people think could affect the cells. We want to keep this drug free as much as we can.
I'm still here.
She's not yelling. Yeah.
Yeah, it's not comfortable, but it's not uncomfortable either. Try to stay relaxed. I know I have to take it easy for 5 weeks, super easy for 2.
Well, it's a good, we don't want too much activity because we want to give the cells a chance to graft.
But I need specifics.
Yeah, we have a specific,
So,
program.
none of your
the whole
exercise,
packet.
and you usually exercise 3 days a week?
What did you say?
You usually exercise 3
Yes.
days a week, so
Yes.
we don't want that.
Okay, not anything, right?
No.
Okay.
So,
You ready for the other knee?
I am.
Good. Let's bioactivate the cells now. Not a drop of blood, right? Which is good. And that's why we use ultrasound guidance to make sure you don't puncture any blood vessels and everything.
Kind of sore right now.
Yeah. And so what the light is going to do, remember we defrosted the cells, those cells are going to look for that homing signal, from the infrared light, and it's going to pull the cells and have them stay in the medial knee joint. And we do that the same with the other side, okay? So I'm going to disengage the decompression. Right. So we don't want to take this off all of a sudden. We want to give the joints the chance to relax and retract very gently. So what I'm going to do, I'm going to take the decompression boot off this side.
What'd you do? Take some pictures of him?
Yeah, the star of the video.
Oh, good.
Isn't it the dog? No? Let's do the dog next, right?
Dan's looking around like, what's going on here?
Yeah, did he smile?
Huh?
Yeah,
Did he smile?
very pretty.
What's happening here?
Tell Jim he needs to hook up the power for other light stem.
What do you need, Dr. You?
Hey Ben, could you get the other light stem going?
They're on mute.
No, there's
There-
one back here, you
there's
gotta
one
plug
right
it
here.
in. Yeah. As a New Yorker, I'm always 10 steps ahead of everyone.
Somewhere.
Drives me nuts. There you go. So now we're gonna slide this one this way because we want to pull that knee out. In fact, I'm gonna accentuate that by having you slide over towards me as much as you can. Don't want to fall off because I want as much lateral pull as we can. That's good. A little more. Perfect. So here's how we do the knee decompression to open up the medial knee joint.
So you 3 ladies doctors or nurses?
Nurse practitioner.
Okay, a little more towards me. I need that more straight. Go towards me a little more. Here.
There's something up here that doesn't fit my...
Could you fix that headpiece for her?
Can I go back a little bit?
I could take one out.
Wait a minute. No, now it's okay.
That's okay?
Yeah.
Slide just a little over so you're in that gap. Just a little over. Good. Comfy?
Yeah.
Good. Perfect. All right, ultrasound scan, please.
Okay,
Maybe
I'd
the
like
medial
some
knee
gel,
joint.
doctor, please.
Yes, ma'am.
So I can get some conductive media going here.
So I'm going to go ahead and decompress that knee. So here we have this one is even more, a little more
Narrow.
degenerated, narrowing. Do you have more pain on the left side usually when you open? Yep,
Definitely.
that's why she has more pain
Okay.
there. So we identified the space. It's opening up with a decompression.
So you think maybe now, sometimes my knee just, for no reason, gives way, you know, if
Yeah.
I'm standing or walking.
Uh-huh.
Hopefully that will help.
Well, when you have decreased space, you know, it can catch like that, right? So,
Yeah, hopefully this will help. I don't want your knee to go.
Do we want to put this back in your office, the ultrasound? After you-
we can leave it here
Okay.
for the next procedure.
Okay, I'm gonna put it right next to the computer
Superior,
here.
inferior.
Nobody knocks it off.
You get a little more inflammation superiorly. So we go to a superior approach right here.
It's interesting because where I usually feel it is down at the base.
Well, it's the whole medial meniscus that needs
Yeah.
the repair. I just want to make sure the cells go in the point of greatest inflammation, because the cells will look for inflammation. So it has the most what's called cytokines or homing signals called pericrete signaling. That way the cells don't go in the wrong area, right? So we're going to go in the superior marker right there. We'll just get this out of the way temporarily so we can get that side
You
going.
could, we're probably okay with your space. You could probably stop leaving there. You did. Okay.
There's 3 spots.
We're going to go in the superior.
This way, from the top.
I'm just going to go with the top one. I didn't like those markings because there was more inflammation on top right there. Plus that's by my favorite point. Cryo spray, you numb the skin.